Have you noticed that your nails have changed over the years? Maybe they're weaker, have a different color, or even have small marks that weren't there before. It might seem insignificant, but what if I told you that your nails could be sending you an important health warning? Our body is an incredible machine, and after age 60, it gives us subtle clues about what's going on inside. The problem is, we often ignore these signs. Nails, which many people see purely as an aesthetic concern, can actually reveal far more than we realize. They can reflect blood circulation, organ function, and even nutrient absorption. Now, this isn't a reason to panic, but rather to pay attention. When we notice these changes early, we have the chance to act quickly and prevent complications. So, if your nails look different and you've never considered what this could mean, stay with me until the end of this video. Today, I'll show you 6 signs your nails might be giving you that could indicate serious health problems. Let's start with one of the most common signs that many people simply ignore: yellowish nails. Have you noticed your nails are constantly yellow and thicker than before? The first thing that comes to mind might be a fungal infection, and indeed this is a very common cause, especially for people who wear closed shoes for long periods or have circulation problems in their feet. But what few people realize is that yellowish nails could also reflect something much bigger. People with liver diseases, for example, might develop this nail color due to toxin buildup in the body. Additionally, respiratory system issues such as chronic bronchitis can affect oxygen circulation, giving nails a yellowish hue. In other words, if your nails have been yellow for a long time, even after treating potential fungal infections, it's crucial to investigate further. Sometimes a small detail can provide a clue about something that requires more attention. Now let's move on to a sign many people notice but don't associate with health: brittle nails. Have you noticed that even a small bump makes your nails chip or peel? It's true that as we age, our keratin production decreases, naturally making nails more fragile. But when this fragility becomes constant, it might indicate that your body lacks essential nutrients. Iron deficiency, zinc and B complex. Vitamins are among the main reasons for weak, brittle nails. But do you know what else could be behind this? Thyroid problems. If your thyroid isn't functioning correctly, your metabolism slows down, directly affecting nail, hair, and even skin growth. So, if along with brittle nails, you're experiencing excessive fatigue, hair loss, or dry skin, it might be time to get tested and check your overall health. And this is just the beginning. Now that we've covered these first 2 signs, let's move on to the next one, which could be a significant warning of more serious issues. Have you ever noticed a deep horizontal ridge running across your nail from one side to the other? It might seem like just a small detail, but what if I told you this mark could indicate your body has experienced significant stress? These marks are known as Bowes lines, and they appear when something temporarily interrupts nail growth. This can happen after a severe infection, surgery, or even a period of malnutrition. Your body gets so busy trying to recover that nail growth drastically slows down. When the body returns to normal, the nails resume growing, leaving a mark as a record of what happened. The problem is, in some cases, these lines could indicate something even more serious, such as uncontrolled diabetes or cardiovascular issues. If you notice these marks on several nails at once or frequently, your body might be trying to tell you something important. Ignoring this warning can allow a silent illness to progress unnoticed. So pay attention, and if you see these marks, talk to your doctor as soon as possible. Now, let's move to one of the most visible yet often ignored signs: bluish or whitish nails. Have you noticed your nails appearing paler than usual, or even with a bluish tint? This isn't by chance. The color of your nails reflects the oxygen level in your blood. Bluish nails might indicate poor circulation, respiratory diseases, or even heart issues. Of course, sometimes cold weather can temporarily cause fingers to turn purple, and that's normal. But if your nails remain this color regardless of temperature, it's a strong signal that your heart may not be pumping blood properly. And what if, instead of blue, your nails look very pale or white? This could indicate severe anemia or liver diseases such as cirrhosis. The blood might have a low concentration of red blood cells, impairing oxygen transport throughout the body. This can lead to symptoms like constant fatigue, dizziness, and shortness of breath, signs often mistaken for normal age-related tiredness, but treatable if discovered in time. Now here's a detail few people notice, yet it can be one of the most important indicators of internal issues: nails starting to curve downward, becoming rounded almost like an inverted spoon. This phenomenon is called digital clubbing, and it doesn't happen by chance. This change in nail shape can be linked to chronic lung diseases like emphysema or pulmonary fibrosis. When there's prolonged oxygen deficiency in the blood, tissues at the fingertips start growing irregularly, altering nail shape. Additionally, this curvature can be associated with gastrointestinal conditions affecting nutrient absorption, such as celiac disease or advanced liver issues. If you've noticed a change in your nail shape and also experience excessive fatigue, shortness of breath, or frequent digestive discomfort, this could be your body's signal that something needs investigation. Now imagine one day you notice small dark spots on your nails, almost like bruises appearing out of nowhere. Sometimes it might just be minor trauma, something that happened without you noticing, like hitting your hand somewhere. But what if this spot doesn't go away? In some cases, these spots could indicate subungual melanoma, a rare type of skin cancer developing beneath the nail. This cancer is more common in older people and often goes unnoticed because we assume it's just a bruise. The difference is that it doesn't fade with time. If you notice a persistent dark line or a spot that begins to grow on your nail, see a dermatologist as soon as possible. The sooner the diagnosis is made, the better your chances for effective treatment. Have you ever noticed a deep horizontal ridge running across your nail from one side to the other? It might seem like just a small detail, but what if I told you this mark could indicate your body has experienced significant stress? These marks are known as Bowes lines, and they appear when something temporarily interrupts nail growth. Now that we've discussed these essential signs, there's more important information to help you better understand how your nails can reveal what's happening inside your body. So, let's continue. Now that you know your nails can reveal important health signals, there's another detail many people overlook, but it can be one of the most revealing. Have you ever noticed tiny pits or dents on the surface of your nails? This might seem like a purely aesthetic detail, but it can actually signal autoimmune diseases such as psoriasis or rheumatoid arthritis. Psoriasis, for instance, doesn't just affect the skin. Often it begins in the nails before appearing elsewhere on the body. If, besides these tiny pits, you notice your nails becoming thicker, breaking easily, or even starting to separate from the skin, this could indicate something serious happening within your body. The same is true for rheumatoid arthritis, an inflammatory disease affecting joints. And the most surprising part, nail changes can appear years before more severe symptoms develop. Another seemingly harmless detail worth paying attention to is very slow nail growth. It's natural for nails to grow somewhat slower as we age. However, if you notice your nails have practically stopped growing, this could be linked to circulatory issues or severe nutritional deficiencies. Nail growth directly depends on blood circulation. If blood isn't adequately reaching the extremities, such as hands and feet, nails may grow irregularly or extremely slowly. This could indicate diabetes, vascular diseases, or even heart problems. Additionally, if your hands and feet constantly feel cold, don't ignore this symptom. It could signal poor circulation that needs immediate attention. Now here's an issue many have noticed, but may not understand. Nail detachment. Have you noticed a nail starting to separate from the skin for no apparent reason? While this can occur due to trauma, such as accidentally hitting your nail, it could also indicate something more serious. Thyroid diseases, aggressive fungal infections, and reactions to certain medications can cause nail detachment. Frequent contact with chemicals, such as cleaning products, can also weaken the bond between the nail and skin, leading to this issue. If you notice this happening frequently without clear explanation, it's crucial to investigate. Small signs like these can be your body's initial warnings that something isn't right. Now that we've reviewed these 6 important signs, the question remains, what should you do if you notice any changes in your nails? The answer is simple: don't ignore them. Our body communicates with us constantly, and many diseases can be treated or even prevented when caught early. So if you've noticed any of these signs, schedule an appointment with a doctor or dermatologist. Sometimes a simple checkup can prevent more significant issues. And remember, nail health also depends on your diet and blood circulation. Maintaining a balanced diet rich in vitamins and minerals and ensuring healthy blood flow through good lifestyle habits makes a significant difference in the health of your nails and overall body. If this video helped you better understand how your nails could be sending important signals, like and share it with someone who also needs this information. And of course, subscribe to the channel for more valuable tips on health and well-being after 60. Remember, paying attention to small details can make a big difference in living a healthier, happier life. Take care.